My name is Akupe myself. I qualified to be a urologist in the year 2010. So this is 15 years of practice as a urologist. Mainly caused by bacteria, especially that from a gram-negative E. coli. It's the commonest cause of urinary tract infection. Lifestyle, yes. You have to keep a clean perineum. That's one. Clean, convenient for it to ease itself. Avoid unprotected sexual intercourse and reduce the frequency of intercourse. First, the person will manifest symptoms of urinary tract infection, which is mainly urinary symptoms. There will be increase in frequency of urination, both in the day and at night. Urine may be offensive and you may have pain on urination. These are some of the common ways it can present. When you have the symptoms, you have to visit the doctor. Likely they're going to run some tests, urinary tract, urine microscopy, culture and sensitivity, in which you try to collect a clean urine using what we call a midstream urine, the urine at the middle of the stream. Before you collect the sample, the initial urine that comes out will be discarded, and you can now cut from the middle and send for analysis using a sterile bottle. So from then, depending on the patient's symptomatology, if the symptoms are severe, you may start them on empirical antibiotics while waiting for the result of culture, because culture takes about 2 days to be out. Prostate cancer is the commonest cancer in men and is the commonest cause of cancer-related death in men. Prostate cancer can be cured if picked early. Unfortunately, early prostate cancer has no symptoms. When the symptoms occur, it's likely to be late or advanced. But you can pick early prostate cancer when we do active screening of patients. Usually patients above 40, some say 45. We screen them, and by screening we mean doing routine prostate examination using the finger. You pass the finger through the anus and you feel the prostate. We call it digital rectal examination, and routine PSA check. PSA is a prostate specific antigen, and the normal PSA value is 0 to 4 nanogram per ml. So patients above 45 are screened routinely yearly or some 6 monthly. If the PSA is high, you have to now further evaluate to rule out prostate cancer. Like I said, it can be cured when it's picked up early. The risk factors for prostate cancer include the black race. Coming from Africa puts you at risk. Then family history. If you have a relation who has family prostate cancer, then it puts you at risk. First degree relation, and also age. The older one gets, the higher the risk of developing prostate cancer. Once somebody has cancer, that person should sought for care, and care is multidisciplinary. Involves surgery, radiation, chemotherapy, and so on. But generally, once somebody is diagnosed with cancer, cancer has to be staged to know the extent of involvement, and you use a suitable treatment pattern for that person. It should be treated. So remedies are just supplementary, but they are not actively used to treat prostate cancer, but they can support the management. So we advise patients to routinely come for PSA check. More so, somebody with a positive family history of prostate cancer should be screened, checked more frequent. But generally, anybody above the age of 45 should have a routine PSA check and to see a urologist at least once a year for evaluation. Like I said before, early cancer can be cured when it's picked up early. It's only when they come in late that we may not be able to cure or can manage them. Women with urology is an expert in surgical management of urinary tract diseases, kidney, ureter, bladder, urethra. So women that passes blood in the urine should see a urologist. Women that have pain in the flank, which most likely commonly caused by stone in the urinary tract, should see a urologist. Women with repeated urinary tract infection should see a urologist. Stones can usually form in the urinary tract, not just the bladder, the kidney, the urethra, the bladder, and the urethra. Sorry, the kidney, the ureter, the bladder, and the urethra. Generally, stones are formed when the solid concentration in the urinary system outweighs the solvent. Stone forms. Just like when you pick a cube of salt now, pick salt now and dump in water, the salt will dissolve. As you add more salt, keep dissolving. You get to a point where when you add salt, it no longer dissolves again. At that point, it reaches the solubility complex. Same thing happens with stone in the urinary tract. When you take plenty water and the solvent concentration is less, it will not crystallize. But if you have high solvent concentration in the urinary tract with less water, it will crystallize and form stone. So generally, when you take plenty water, no matter what, plenty water will tend to reduce the risk of stone formation. But if there is so much solvent in the urinary tract that does dissolve, it will form stones. Benign prostatic hyperplasia. Now, generally, above the prostate is an organ in the male reproductive system, and above the age of 40 it begins to increase in size. Two things can cause this increase in size. That's ordinary increase, otherwise called benign prostate hyperplasia or cancer of the prostate. Both of them have common similar symptoms because the urine flows through the prostate to the urethra to go out. And as the prostate increases in size, it narrows the channel where urine flows from. So patients will come with symptoms of urinary obstruction or urinary irritation. We call it multiple symptoms of urination. This can happen in both prostate enlargement or cancer of the prostate. But generally, for a benign condition, benign just means friendly. Hyperplasia just means increase in number of cells. So there's increase in number of cells and it's friendly. Normal cells just increase in number. Unlike cancer that has malignant cells, abnormal cells, this is number. So like I said, from the age of 40 and that's mainly present with urinary challenges. Difficulty in passing urine, which can be characterized by poor urinary strain. Patient may strain to pass urine. Patient may pass urine more frequent at night, and it gets to a point where the patient may have what we call urinary retention and urine cannot flow out again. So you can easily pass rubber from the penis to relieve the urinary retention. When we evaluate them, we do a scan will show increase in prostate size above 30 grams. Normal capsule, the capsule is not regular. Then we do their PSA check. PSA will be within normal value, 0 to 4. So you have an enlarged prostate with PSA within the normal range. It's most likely due to benign prostate hyperplasia. And depending on the symptoms, or you can score the patient may have urinary complaints. So depending on the symptoms, you may try to manage them. Some may have the enlargement and have no symptoms, so just observe them. Don't do anything. There are some instances that have mild symptoms, we give them drugs, and if they have severe symptoms, we may evaluate them. Just offer them surgical intervention to relieve the obstruction. Natural phenomenon. Yeah, it's a natural something. But it doesn't happen in everybody. There are some good at 68, 17, and they have normal prostate size, so it doesn't matter. It's just natural phenomenon. Some may have, some may not have. But relatively, increase, if you take plenty, Plenty fruits like tomato, carrot, melon, all may improve prostatic health. My name is Akupe myself. I qualified to be a urologist in the year 2010. For these 15 years of practice as a urologist.